Hi everyone, I'm Dr. Gavin Macgregor-Skinner. I'm going to be your course instructor for the next 14 weeks for the course MSCI 5003 Humanitarian Practice and Principles. This is part of the Extreme Medicine Certificate at Northeastern University. I live in Washington DC. I've been here now for nearly 30 years. I'm also an associate professor at the Penn State College of Medicine. I've been doing that since about 2011, where I've taught each year three 15-week courses in public health preparedness for emergencies, disasters, and acts of terrorism. I'm also the senior director of the Global Biorisk Advisory Council, and we work on a lot of challenging type projects for both government and non-government in slavery, trafficking, as well as promoting cleaning professionals throughout all of the industry in hospitals, nursing homes, and in deployments for disasters and emergencies to ensure they get the proper training and recognition. But for this course, I'm going to really focus on some of my personal experiences, such as and share those with you. And I think this is one thing about our community, whether it be austere medicine, emergency medicine, humanitarian disasters, acts of terrorism. We're a very close-knit community. We share stories and experiences to learn from each other, best practices. So throughout this 14 weeks, I'm going to be sharing some of my experiences. I've had 3 30-day deployments to Afghanistan with the US Department of State. I've had 2 30-day deployments to Iraq, again with the US Department of State. In 2014, I was deployed 3 times. Each time was for 21 days to both to Liberia, Nigeria, and Sierra Leone, where I led teams and managed teams to establish and manage Ebola Hospitals on behalf of the US Department of State. I've also had 3 30-day deployments to Pakistan, which we'll talk about. And then way back in 2004, when I was working at CDC as a epidemic service officer doing epidemiology, I was deployed to Banda Aceh for 9 weeks in response to the Tsunami and Earthquake, and led a team on behalf of the World Health Organization doing needs assessments over a 9-week period. And then I also spent 12 years in the military, both the 8 years in the Australian Army and 4 years in the British Army. I'm going to talk about some of my deployments to, say, East Timor, Bosnia in 1996, 12-month deployment to Northern Ireland in 1994, and some of the lessons that I've learned, things that I've picked up that may actually help you in your career development for getting ready for doing more within extreme medicine, austere medicine, working in maybe large-scale humanitarian crises as well, mass casualty events. So I look forward to meeting you and working with you over the next 14 weeks. So welcome to the course, and I'm going to post my contact details so that you can stay in touch with me whenever it's convenient for you, so that I can provide you the best learning experience that you can have throughout MSCI 5003.